everybody. We are preparing for our Kahoot game night. We got a special day. This was the bonus session that you guys wanted. So go to kahoot.it. This is the pin. Write it down. Tell everybody. I need somebody to put it in the chat for me. The pin is 869-5372. Okay, so go to kahoot.it. Pin is 869-5372. We're going to get started in 5 minutes. Hey, Remar nurses, welcome to our live NCLEX game night here by Kahoot. All right, and so there are two ways for you to play. Well, the first one is you need a device to go to YouTube or Facebook or however you're watching me, which you probably already have. Now, you need a second device to be able to log your answers in tonight to actually play in the game. So if you're watching me on one device, just get your cell phone and go to kahoot.it, okay? Kahoot.it, and then you're going to put in the code, the PIN, which is 8695372. Okay, so if you go to your browser, Safari, Chrome, go to kahoot.it, put in the game pin 8695372. We got about 366 students right now waiting. And then you will put in a nickname. And once you put in the nickname and it says you're in, you're in. Okay, don't go to the left, don't go to the right, just be in there. I wanted to get this game going. Typically, I try to stall and let other people come in, but while I'm not stalling today, I actually have a Remar nurse here who recently just passed Next Gen NCLEX, and I want to give you guys the opportunity to ask her anything that she can share with you on your journey. I love this Remar nurse. Her testimonial is so amazing. She's going to keep it real with you. I'm going to bring in Nurse Kim. Nurse Kim, hi, how are you doing? Let me see if I can get her in. Are you doing it? Okay, there we go. There she is. We're twinning today. Say hello to everyone.
Hi, Remar family. Remar nurses in the house.
Remar nurses in the house. I love your With God is Possible shirt. We are twinning today. We are definitely twinning today. So let everybody know where you're from and what NCLEX did you pass, RN or PN?
Oh, okay, so I'm from outside of Philadelphia. I'm from Springfield, Pennsylvania, and I took the Next Gen NCLEX RN, and I took it in. Yes. Mm-hmm. And I passed it. Sorry.
Yay. Now you passed the NCLEX exam. So amazing. You are the epitome of what I want Remar nurses to be, because you did what you had to do, even though your road to NCLEX wasn't perfect. Talk about your struggle a little bit.
Oh, yes. I had a great struggle. So I actually, I didn't see it as a struggle at first, but I went to nursing school at the age of 50 years old. I called myself my mom's student. But anyway, I went to nursing school and I graduated. I did very well in school, but I waited for my age. So it took me from May to November of 2022 to even get the code. So I took the test. I did not pass. I used different resources. Mm-hmm. That time I used Mark Clinic, ATI, and UWorld. Then the problem with that is that, I was looking forward. I already had a job offer prior to even graduating. I had a job offer. So I didn't pass the NCLEX. So now I'm worried that, okay, now I'm not going to be able to do this job. So then I took the NCLEX again in February, and I did not pass. The job still waited for me.
Wow.
And at that time I used Alpha Slice or something like that, Alpha Slice. Mm-hmm. And I didn't pass, which I didn't, the first time I was really horrible as far as upset. They asked God, why me? Like, what is going on? Pass it, But anyway, so then one of my cousins told me about Remar. And so I joined it right away. But as far as my struggle is concerned, so I already started out kind of rough because I was already a widow at the age of 43. And I had already lost my parents long before I even turned 25. So, orphan and a widow. So that's challenging, Yeah. So working hard and everything. And I saw nursing as a way to make a difference and as a ministry first and foremost, but also as a financial help. So now, if you fast forward, when I had 10, when their dad died, then they're both in college. So I have to pay. I'm in school, and my two children are in school. Yeah. Okay, then now fast forward, and I found out that my sister was diagnosed with cancer, triple negative breast cancer. So of course I want to be there to support my sister. So I'm trying to prepare for that. I have to prepare, to minister to my sister and help her. And then come to find out, I put everything on hold in life trying to pass these tests. And then I ended up not taking care of myself, and ended up having a scare of 2 types of cancer, breast cancer and thyroid cancer. That's what I was at risk for. And so I was so nervous. I didn't even realize how much time had gone by. That's how I was on trying to pass this test. So,
life.
Anyway, right. So I missed all the screenings, all my stuff I was supposed to do. So I had all that on top of it. But after that, then my cousin told me about the REMAR. So I joined the REMAR. And I'm going to tell you, some people, I'm not sure if who's on this at the university right now, but some of you may be doing the YouTube and you didn't subscribe to the V2 trainer. I'm just going to tell you, don't play like that. Don't do it. Because I'm telling you, I'm going to hold up my books like they do in the testimony. You need your next gen quick facts. You see all my tabs on here? You need it, and you need to read it and study. Then my NCLEX virtual. This is very, 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 very important.
Nice.
And the thing that makes it stand out. So even though I had all those struggles, I forgot to say. So come to find out, that job waited for me all that time, and then they said no, because I did not pass that test in February, and it was an emergency program, nice, excellent program, and they said no because I didn't pass that NCLEX. So imagine how I'm feeling. And at the same time, the tuition bills coming in for the kids. I'm trying to make ends meet. So when you're talking to me, Nurse Kimberly, you look at a person who really, you're looking at somebody who started out late. So it's never too late for you. Don't think that you're worrying about your age or your 20th time and all that stuff. That's irrelevant. Okay. That's irrelevant. Now, this is important, right? You can't be one of those people. I'm telling you, I named all those programs. I don't see what we don't have to do here. We don't have to. I don't care nothing about that. That's just like you spending your time talking about the devil. I don't care. I'm talking about the truth. Okay.
I love it. I love it. I love it.
The truth about this program. I don't want to hear them other. I want to tell you is that this is authentic. This is not a gimmick. This is not somebody trying to get your money. Act like, just a fake. This is a fake program and you're not really going to pass. That's on you. This is a place where they care about you. But the thing about this program is it's true. It's about the content. Now look at me. I just came from the test, y'all. I'm not going by what somebody else say. I'm a walk and live a testimony. I took the test.
Yes.
This program here, I'm going to tell y'all right now. When Professor Regina is telling y'all, she's telling you the truth. It's all about the content. But the thing that's so beautiful is not just, she doesn't just teach us the content. She teaches us to think critically. You should have saw me on that test. I was acting like I was at REMAR University, okay?
Tell the truth.
Let me tell you, the REMAR University thing is hard. Oh, Lord G. I was fussing at Professor Regina because I was trying to that final, them 2 final exam. Okay. That thing was tough. So hard. And let me tell you, it was harder than the NCLEX. I'm going to tell y'all, at least the one I took. I'm telling y'all the truth. And I kept seeing her face and hearing you get the little board or whatever I wrote on there. Y'all know what she taught us now. We can, we must, and we will pass our NCLEX. I wrote that right on my little board.
I love it. I love it. I love it.
Okay, so what I'm saying is, and one thing y'all have to know, and I learned this in my, my maturing time, it's not just about memorization. You're not gonna make it. And you might memorize medication, you might do great with that and all, but you have to read for understanding. You can't just worry about memorizing, because what's going to happen is you're going to have all your facts together. Like when you're in the crunch of that NCLEX, see, you got to practice with this. Okay, now on my testimonial video, I said this, and y'all probably said this lady's mean or crazy. I said you have to listen, because you know what? Don't try to come back to Jen and come back. No, it's only going to work if you do the work. Now, she's nice to us. She's professional. Okay, she gives you a schedule. It's not rocket science. You have to read that schedule and follow the schedule. You got to do your test. I know some people, you have challenges in life with your schedule. You're working. You're not like a traditional student. If you're early, some of you might take longer. You got to know yourself. Don't try to, because it says it there, the number of weeks and you should be here these weeks. if you're not there, reschedule your test. Now here I go. I was like, I wanted to cry because I wanted a little more time, but I couldn't because my last possible day was July the 4th that I could take my test. So I had to sign for July the 1st. Wow. And on my last remark class, I was like, Lord Jesus, I need some more time.
But I didn't you did it. You did it. You ain't got no more time.
But yeah, so guys, you can do it. Please do not be down on yourself. Like with my shirt, with God is possible. Definitely. There's nothing that's impossible. And guess what? You're equipped. See, that's what I'm trying to tell you. Do this course. This is not a game here. When you do this course, you're gonna really come out competent. You're gonna come out feeling like you're gonna come out with a deeper understanding. So the topics, those challenging topics, and maybe not for all y'all, but ABGs and oh my Lord, hypovolemic shock, stuff like that. The way that it's broken down in this program is absolutely amazing. And that's also what I wanted to say. Some people say it's so extended. The videos take you 3 hours. On all this, not only are these videos a perfect length.
Yes, those videos are too long.
And guess what? Guess what? Y'all see, I gotta tell y'all, don't fall on for them tricks. See, trickery won't get you nowhere. Let's say you pass it with your little trickery that the other programs teach about this trickery, and this is it, and this is how you do. But wait till you be a nurse on the floor. Are you going to be ready to be a nurse? Because if you're doing all them tricks don't work when you're working with the patient. But when you do this program, you're going to learn. Look at each one of those videos. Now, it depends on what kind of learner you are. You might got to re-listen to the video, but not only look at it, take your notes. Now, Professor Jean don't tell you that you have to take notes, but to me, to reinforce, I got to write something down. I watch it, write it down.
I told y'all she was going to keep it real.
I'm going to tell y'all the truth. I will never steer you wrong.
Yes.
My nickname is Mama Bear for a reason. I'm here. I can love on you, but I'm gonna tell you the truth though. I'm not gonna lie to you.
I love it. I had to get you in front of the students tonight. I know you are super busy. You have so much going on. Yes, but no, I just wanted to come on here. You were such an amazing testimonial. Went back to school, definitely non-traditional student. Went back to school having full-grown kids in college, and the difficulties of not having the family support, that you would hope for your sister, but having to be there for your sister and be there for your kids and be there for yourself. So yes, with God is possible.
Yes.
The testimony of that. So we just say congratulations as a whole collective. We love you. We're proud of you. Go out there, come back, and we might invite you back. You're in PA. So thank you so much.
Y'all can do it. Don't give up, nurses. You're gonna have your NCLEX too. Do not give up. It's reachable.
They're ready. They're here. It's game night, everybody. Thank you so much, Nurse Kim.
Thank you guys. Love you guys. Bye.
All right. For the rest of you, it's study time. Go to Kahoot.it. I think you guys are in. All right. Try it one more time. Get in Kahoot.it. Put in the game pin 8695372. We gotta go now. All right. Who's next? Who's gonna be my next testimonial? That's what I'm looking for. Because Nurse Kim said she remembered when I asked that question, and she said I'm next, and she really was next. Let's go. I see you, Jessica. I see you, Lynn. I see you, SSJLLC. I see you, Trice Sandy. First place prize will be $200 cash app. I don't care what you do with that money. This is for you for knowing a whole bunch of stuff. Okay, a whole bunch of stuff. Prioritization, safety, infection control. We in there. Got a wonderful testimony, and I'm starting this thing in 5, 4, 3, 2. You ready? Ready. Let's go. All right. Game night tonight, July 3rd. First question is this. A client reports itchiness under his cast. Which nursing action is best? Is it give acetaminophen or ibuprofen, gently tap on the outside of the cast, administer antihistamines as ordered, or blow warm air into the cast? Cast care, what nursing action is the best? itchiness. It gets itchy under there. The skin begins to itch. What do we teach our patients? Give acetaminophen or ibuprofen. Gently tap on the outside of the cast. Administer antihistamines as ordered. Blow warm air into the cast. North Carolina, I see you in the house. Reading is fundamental, guys. The best thing for that nurse to teach the client. And remember, one of the things that we're worried about is what? Skin breakdown. Okay? Skin breakdown. So think about what y'all picking, because a lot of these answers are wrong. Correct answer actually was gently tap on the outside of the cast. Who is our leader on today? Miranda, I see you. Top score right now. Gently tap on the outside of this cast. Locate the itch and gently tap to relieve it, okay? Because remember, you don't want to blow warm air. What kind of air do you want to blow underneath the cast? Not warm air. That's not going to be the best thing. Put in the comments if you know. Let's go. Moving on. Question number 3. Yeah. Double points for this one. You want to blow cool air. That's right. A nurse cares for a client with Cushing's syndrome. Which physical characteristics are expected? Select all that apply. All right. Talking about Cushing's syndrome, which physical characteristics are expected? Is it a round and puffy face, memory loss, thin extremities, or fatigue? What do you guys say? All right. What do you guys say? What are we expecting here? And again, I can't stress to you enough, your NCLEX date is coming. So you need to be grafted into our community. You need to be liking the Facebook page, subscribing to the YouTube channel, because we gets down like this very often. And one of my main goals is to teach you how to critically think, all right, through content. So game night is one way that you can put your content to the test. How are you doing? Are you doing well? Are you doing good? I'm going to try not to teach too much. I just want to show you the answers. But bam, correct answer here was round and puffy face and thin extremities. Way too many of you picked fatigue. Way too many of you picked fatigue. So I'm going to stop the game right now and say, make sure that you are reading. Make sure that you're reading and not just going off, answering your own questions. This says here, what physical characteristics are expected? Fatigue is not a physical characteristic. Nobody should have picked green at all. Nobody should have picked green. It's not a physical characteristic. All right. So let's proceed with caution. All right. Let's proceed with caution here. All right. Banty took the lead on that one. I see you, Miss Keen LPN, joining us. Round and puffy face. So when we talk about Cushing's syndrome, we have obesity of the face, right? We have upper back buffalo hump, the trunk, the extremities are thin arms and legs. These are physical signs of Cushing's syndrome. Slow down, guys, and read correctly. Okay. Quiz time. Double points here. An elderly client with lung cancer on comfort care only reports dyspnea over the past several hours. Which nursing action is most appropriate for the nurse to do? Is it administer high doses of opioids as ordered? Change intravenous IV therapy to normal saline? Give bronchodilators as ordered? Or notify the primary care provider immediately? Ooh, okay. All right. What is the appropriate nursing action if a client with lung cancer on comfort care only, they start reporting shortness of breath for several hours? All right. What are we going to do? Are we going to administer high doses of opioids? Thinking about that. Change the IV therapy to normal saline? Give bronchodilators as ordered, or are we going to notify the healthcare provider immediately? Oh, this is a good game night. This is challenging. I'm bringing the pain on Monday night. Let's see, was I able to trick a lot of you guys? Okay, so the majority of you guys did get this right. Give bronchodilators as ordered. But again, for me, too many people picked the wrong answer of notifying the primary care provider immediately. So many reasons why you don't need to do that. So many reasons why you don't need to do that. All right. Let's see our scoreboard. Leadership board in place. Some changes are being made. Give bronchodilators as ordered. The client's symptoms are what expected. So what we do is we give what we have in place. Bronchodilators are going to relax the muscles, okay, and widen the airways. Why don't we need to call the doctor immediately about this? So many reasons, right? Number one, the client has what? Lung cancer, and they're on comfort care only. So there's not going to be any emergent interventions that are going to be happening, guys. So again, what I'm trying to expose tonight by giving you challenging questions, because usually we've been doing stuff from quick facts, right? We've been doing little stuff from quick facts. I'm giving you critical thinking situations tonight, all right? And they're exposing your areas of weakness. For most of you, it's just reading. It's not the content, it's reading, okay? The client was on comfort care only. Here we go. A male client rates his pain 4 out of 10. Which nursing action is most appropriate for the nurse to do? Number one, is it administer morphine 2 milligrams IVP? Administer promethazine 12.5. Okay. Administer hydrocodone 5 milligrams PO. Administer docosahexaene sodium 50 milligrams PO. What shall we do? All right, we are exposing our strengths tonight. We are celebrating our strengths tonight. The questions that you get right, pat yourself on the back, because these are critical thinking style questions. What is the most appropriate for the nurse to do? What is the most appropriate for the nurse to do? And I love it. It seems like we are leveling out. We are settling into this game, and we are all on one accord. Let's see how we did. Correct answer, yes, these are the numbers I'm looking for. The majority of us have chosen the right answer, administering the hydrocodone 5 milligrams. Okay, good job, everybody. This is the best pain medication for moderate pain. The morphine is for a little bit more severe pain. Yes, the pain tailor is only 4 out of 10. So we don't want to go overboard, okay, with the IV medication. Good job, okay? All right. Okay, so here we go. A client is receiving 1 unit of packed red blood cells. After 15 minutes, the client becomes restless and reports itching. Which intervention should the nurse implement first? Red, assess the client's vital signs. Yellow, notify the healthcare provider. Blue, maintain a patent IV line. I should say patent, sorry. Or green, stop the transfusion at the hub. What should we do? Client is getting blood. They become restless. They become itching. They report itching. Are we going to assess the vital signs? Are we going to notify the healthcare provider? Maintain a patent IV line or stop the transfusion at the hub? What's the safest, most prudent thing for us to do? Remar nurses, show up, show out, win cash, get your confidence back, prepare for your test that's coming soon, all with 1,000 other people on the same journey, only here at Remar. This is so amazing, guys. Correct answer. Did we get it right? Yes, these are the numbers we want to see, guys. All right. Okay. The correct answer, stop the transfusion at the hub. Please stop it first. The nurse should stop the infusion at the hub and not allow any more of the blood to enter into the patient's body. Good job. Okay. Moving on, this game is a fast game. Here we go. The client with the DVT is reporting chest pain during inhalation. Which action should the nurse take first? Number one, prepare to administer heparin. Yellow, ask the doctor to order a lung scan. Blue, place oxygen on via nasal cannula. Or green, tell the patient not to ambulate. What is the priority action of the nurse right now? Oh, this is critical thinking right here. This is the challenge. Your patient with the DVT, they have chest pain. Woo, what are we going to do for this patient? I know you could probably get it down to 2. It's probably blue or green. You're probably like, is it place oxygen on the patient or tell this patient don't move? Tell this patient not to ambulate. What do you think it is? Put those comments on the screen, enter them on your game night. The largest NCLEX study session is happening right now, and you're here. Correct answer. Did we mostly get it right? Let's see what we did. Ooh, it was close. Correct answer was the blue, but a lot of you picked the green. Okay, let's see if it changed our leadership board. It did. Larry, welcome to the top 3. Place oxygen on via nasal cannula. Getting oxygen to the body is the priority right now. It is the priority. All right. Let's go. I got to move on. You're going to read about it later. Here we go. The fire alarm begins to go off in a mental health clinic. Which action should the nurse take first? Evacuate all the visitors, people, and patients from the clinic. Instruct the clients to stay in their room. That's the opposite. Immediately call 911 to report a crime or assess if the fire is real. What should happen? The fire alarm is going off. What should happen? You're in a mental health clinic. What's the priority action? Okay. Evacuate all the visitors, people, and patients from the clinic. Instruct the clients to stay in their room. Immediately call 911. Assess if the fire is real. So many things could be going on. All of these things could be right. That's the thing about NCLEX. All of these answers could be right, but only one is right. We need to find the right one that answers the question that's being asked here, okay? Because you've been given a lot of information right now. Did we get it right? What did we do? We indeed, the majority of us did not get it right. Wow, look at this. This is a red flag, people. Red flag right here. I knew the leadership board was going to change with that one. Why did y'all think that was okay? All right, you got to assess if the fire is real or not. It was real. You got to assess if the fire is real. I said it was on a mental health clinic. Everything that you're given on the Next Gen NCLEX is given to you purposefully, especially when it comes to the stem of the question. Let me tell you something. In a workshop for people who write NCLEX questions, they tell us now, do not put irrelevant information into the question. Only put what is important. So if you're in a mental health clinic, you got to think, is this fire real or not? Okay? If the fire, is the fire real or not? The location. One of the things about the Next Gen NCLEX with the new clinical judgment measurement model is that layer where it talks about environmental conditions that change how you prioritize care. If you are in a home health setting, you do things differently than if you were in a mental health setting or if you were in the ICU. You guys got to be prepared for that. Okay, you got to be prepared for that. Because if you're in a mental health clinic and a person with delusions think they see fire coming out of the toilet, are you going to respond with that? Okay. Reading. I'm exposing your weaknesses tonight and your strengths. Here we go. I got to move on. Okay. All right. Which of the following should be avoided in the neutropenic precautions? All right. A jar of apricot jam, a bouquet of white canna lily, a bottle of distilled water, a bowl of mashed potatoes. Okay. What are we going to be avoiding in neutropenic precautions? Okay. All right. We are moving to neutropenic precautions here. 1,200 nursing students have entered into the game environment. Let's see how well you do with here. This one is a straight facts. There's no critical thinking here. You either know it or you don't know it. So I'm expecting us all to be able to recall this fact. All right. Good job, everybody. 10 seconds left to make your answer known. Neutropenic precautions, which one is not allowed? Go ahead and put it on the screen or in the comments. Most of you guys are choosing the right answer. Yeah, overwhelmingly amount. And our leadership board is holding strong. All fresh fruits, vegetables, and flowers should be avoided with neutropenic precautions. All right. I'm moving on. Here we go. Double points for this one. For which condition is airborne precautions applied? Is it hepatitis B? Is it diphtheria? Is it rubella? All right. Or is it tuberculosis? All right. This is straight recall. I have nursing students from all different backgrounds. Prayerfully, you guys have taken your infection control class, or you've watched my video in the V2, and you can answer this one very quickly. The answers are rolling in, almost 500 answers, 460. Airborne precautions are applied to Hep B, diphtheria. Do you know what diphtheria is? If you don't know what diphtheria is, write it down somewhere so you can look it up. Rubella or tuberculosis. Love that. Love it. And be free. Yeah, be free. Share your notes on the screen. Share your answers. What do you know? What have you learned? Here we go. Correct answer. A perfect, guys. The majority of you did get tuberculosis right. A few of you didn't, but you won't forget that one. All right. We are moving on. Sarah, welcome back. 3 right answers. Tuberculosis requires airborne isolation precautions. Okay. On the air with MTV. I love that. What is the nurse's primary duty in assisting a client with multiple myeloma during an X-ray? Woo! Get vital signs. Hold the client with support. Give pain medication. Administer oxygen. All right. So what is the nurse's primary duty with multiple myeloma during an X-ray? Some of you guys just might have to take a stab in the dark because you really don't know. Okay. We got over 1,200 nursing students here. Where are you guys all from? I don't even know where you guys are from tonight. 1,200 all over. Over 2,000 of you joined the V2. Amazing, 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 amazing. Just during R&U, probably more than that, closer to 3,000. Multiple myeloma. Get vital signs. Hold the client with support. Give pain medication. Administer oxygen. Okay, the majority of us, we got Indiana, California during the heat wave. Stay safe out there. All right. Correct answer is hold the client with support. Ooh, what happened? What happened? All right. The most important measure is to provide the client with safety, since pathologic fracture is a common complication of multiple myeloma due to bone deterioration. I see you, Oregon, Florida in the house, NYC, as always. It's a pleasure. New Jersey as well. Yeah. All right. Which of the following should the client avoid during a 24-hour Holter monitoring? Eating fruits high in vitamin C, using an electric razor, taking calcium supplements, sunlight exposure. International students, stand up. Turks and Caicos, Ontario, Canada. Yes. Filipino in Boston. Let's make that straight. Let's make that clear. Love it. All right. We're talking about the 24-hour Holter monitoring. What should be avoided? Eating fruits, using an electric razor, taking calcium supplements, sunlight exposure. Massachusetts, a lot of people from Massachusetts tonight. You guys got a study group going. Indianapolis is also represented here. Puerto Rico. Love it. Love it. Bienvenidos. All right, here we go. Most of you did choose the right answer, which was using an electric razor. A lot of people had picked that other one. Can't remember right now. But Miranda still holding strong. Leo back in the game. Using an electric razor. So electrical devices such as razors and toothbrushes may affect the data captured by the Holter monitor. And we are moving on. What is the most important consideration when caring for a client with Meniere's disease? Maintaining a semi-Fowler's position. Limit visitors as much as possible. Assist the client when going out of the bed. Wear a gown, gloves, and N95 mask when entering the room. Ooh, we're talking about Meniere's disease. Very important topic. You want to know about this because safety is the word for this. And if you understand what's happening to the patient, you can pretty much answer any NCLEX question that you're presented with, which is why I absolutely always lecture on Meniere's disease. Anytime I do an NCLEX review, I'm talking about Meniere's disease. So maintain semi-Fowler's position, limit visitors, assist the client when going out of the bed, or wear gloves, gown, N95 mask. Great job, Remar nurses. Over 300 people got that one right. I'm happy about that. I'm very happy about that. Assisting the client when going out of the bed, because clients with Meniere's disease might experience vertigo attacks quite easily. Thus, assisting the client when getting out of the bed can give stability. And I'm going. In caring for a client affected with Clostridium difficile, what PPE should be worn by the nurse? N95 mask, sterile gloves, gown, or a face shield? What are we expecting with C. diff? Okay, talking about your isolation and infection control. I told you it was going to be a lot of that, a lot of priority, a lot of safety, infection control. These are huge topics under management of care or coordinated care. Whether you're an RN or a PN, this is the stuff you have to know. You absolutely need to be tapped in. Tap in to this, okay? And again, if you don't get it right, you just know this is something I have to go back and do, because these questions should be answered automatically, like easily come to you. You get this one right, bam, above the passing standard. All right, that's a great thing for you when you're taking your NCLEX exam. We want to be 99% confident of our answers. And great job, guys. Okay, good job. For the few of you that didn't pick the right answer, this is something you're going to go back and you're going to address later. Okay. In it to win it, clients who have Clostridium difficile should be put on contact precautions. Healthcare professionals should wear non-sterile gloves and cover their clothing with a gown when caring for them, those patients. I'm moving on. Double point time. When is varicella not contagious? Once the vesicles have crusted, 1 day before rashes appear, the onset of the vesicular rash, or 2 days after the rash appears. Ooh. And this one is going to definitely be challenging. This one's going to be challenging because who really knows the answer to this? Honestly, this is where the content helps you, because you really can't use no strategy for this. Like, you have to know what varicella is, okay? And you have to know the contagious periods. So, a lot of you actually do know it, though. Actually, I'm surprised. I'm shocked even. Good job, Remar nurses, showing up, showing out. Answers on the screen. Now there's over 1,300 of you. You are tagging friends and calling people. Correct answer. The majority of you did get it right. Oh my goodness. Chickenpox must be your love language. How did you know these things? All right. Miranda, I see you holding it strong. Chickenpox is infectious from 2 days before the rash appears until all of the blisters have crusted over. A long time, right? So these patients need to be isolated. Quiz. A client was admitted due to opioid toxicity. Which nursing intervention may be delegated to the practical nurse? Assess the response from the naloxone. Monitor neurological status every 30 minutes. Administer oxygen therapy via nasal cannula. Calling the healthcare provider to report vital signs. What are we going to have the practical nurse do? Now, the patient is admitted due to what? Opioid toxicity. That's important. What are we going to have the nurse to do? The practical nurse. Assess the response from the naloxone. Monitor neurological status every 30 minutes. Administer oxygen via nasal cannula. Or call the healthcare provider to report the vital signs. You made it. You did make it. You made it in. Now just put the answer on the screen. Ooh, okay. So correct answer was administer oxygen via nasal cannula. Remember, for the PNs, we don't have them assessing anything. All right. Very important. You guys remember that. Administer oxygen therapy via nasal cannula. This is something that's within the scope of practice of a nurse. Now, some of you guys did pick call the healthcare provider. You don't really want the PN doing that because the healthcare provider is going to ask for assessment information. And so it's the RN who should make that call. All right, make that call. Next question is this: which of the following tasks is within the scope of a practical nurse? Let's try this again. Perform wound dressing, starting an IV line, diet recommendation of a diabetic client, monitoring neurological status every 4 hours. Which one are you going to go with here? Within the scope of practice of the practical nurse. All right. And this is delegation is basic. Delegation is one of those things that you should memorize the tasks associated with the RN, the PN, and the nurse's aide, or anybody without a license. That could be the nurse's aide or the nursing student. Doesn't matter. They're all going to be treated as somebody without a license. So there are certain things that they can do, certain things that the practical nurse can do, certain things that the registered nurse can do. And if you're an international student, you need to focus on this because in your country is probably not the same as in the United States. Okay. All right. Correct answer is red. Perform a wound dressing. Perform a wound dressing. All right. Here we go. Next question. Oh, like I said, okay. So LPNs can do wound therapy, LPN or LVN, it's the same thing. IV therapy, health teaching, and neurological assessments are for the registered nurse. Quiz time. The first action to be taken when a sutured wound is torn apart, what is it? Call the surgeon for resuturing, apply sterile strips, flush the wound with normal saline, cover with a sterile saline dressing. So this is happening when you have a sutured wound and it pops open, it rips open, it's torn apart. Maybe the patient put too much pressure on it and it burst open. What do we need to do? Call the surgeon, apply sterile strips, flush the wound out, or cover with a sterile saline dressing. What can we do? What should we do? Okay. And remember, don't get crazy. This is not the time to get crazy. This is the time to focus on safety. What's the safest thing for the nurse to do? Okay. Green. Whew. All right. Now you guys are safe nurses. Whoa. Okay. All right. The recommended initial action is to cover the wound with a normal saline dressing to prevent pathogenic contamination. Okay, remember this. This is the safety point. All right, we're going to be finishing up soon. Let's see how we're doing. An infusion pump starts to alarm. What should the nurse do first? Red, check the power supply. Yellow, turn off the alarm. Blue, assess the client's IV site. Green, assess kinks in the tubing. Oh, this is a tough one. What? So the infusion pump starts to alarm. What's the first thing the nurse should do? Check the power supply, turn off the alarm, assess the client's IV site, assess kinks in the tubing. Oh, I'm challenging you guys. I'm trying to mix it up a bit here. Just think about it. I mean, practically, I can't say too much. If I say too much, I'll give it away. All right. All right, everybody. Welcome to the game. Be safe this holiday weekend, please, as well. Correct answer is turn off the alarm. Ooh, y'all just gonna leave. Okay, so here it is. Okay, silencing the alarm will ease the client before troubleshooting. Ensure to turn off the alarm to avoid stress to the client. All right. All right. Correct answer. Silencing the alarm will ease the client. Before troubleshooting, ensure to turn off the alarm to avoid stress to the client. Here we go. Next question is this. Double points. 24 hours after a bilateral adrenalectomy, the nurse must prioritize. The nurse must prioritize preventing bed sores, monitoring for hypovolemic shock, resuming diet, promoting self-care. All right, we're talking about an bilateral adrenalectomy. What are the implications of that? What does that even mean? All right, and if both is a bilateral, so that means both are taken away. Both are taken away. What is going to be the priority? Preventing bed sores, monitoring for hypovolemic shock, resuming a diet, or promoting self-care. When you think about self-care, you think about how the patient is going to feel about themselves, right? What do you think? All right. Correct answer is the hypovolemic shock. Yes, great job, everybody. Let's see how we are doing here. 3 players have answered 19 correctly in a row. Amazing. Bilateral adrenalectomy can often lead to emergency case of an adrenal crisis, and the nurse should monitor for symptoms of hypovolemic shock and vascular collapse. Let's go. Last question right here. A client is receiving torsemide 5 milligrams PO daily. Which finding would indicate adverse effects related to the medication? Chloride 98, sodium 135, potassium 3.1, BUN 15. We are talking about torsemide 5 milligrams PO. What is going to be an adverse effect to this medication? You guys are in it to win it. You guys are in it to win it. Let's hear it, everybody. Where are you thinking when it comes to torsemide? Do you know what kind of medication it is? Do you know what the implications are? But essentially, we're looking for adverse effects. So even if you don't know the medication, you probably should be able to identify an adverse effect on tonight. 1,400 students showed up on tonight, and the majority of you got this final question right. There's no controversy here. The potassium, the only option, all right, that indicates an electrolyte balance was that potassium. It was too low. Beautiful job tonight, guys. Let's see our winners, and I want you to congratulate them because they played tonight. Those questions were difficult. Number 3, hi, Larry. Thank you. Congratulations. Screenshot your podium, please. Vanti, and our number 1 player for tonight getting $200 cash at prize. Miranda, what you gonna do with that money? What you gonna do with it? Vanti, $100, and then Larry, $50. I am so proud of you guys for showing up and showing out on our game night. Whew. This was the final game night of Remar Nurse University. You guys voted for it, and so we made it happen for you tonight. Super excited about it. Thank you, everyone that participated in Remar Nurse University. It is our largest and longest NCLEX review that we do. Second only by 7 days of NCLEX. We have 7 days of NCLEX during the Christmas holiday, and then we have Remar Nurse University during graduation season. So congratulations to you guys for sticking with us and enduring. But we have more because it's Monday, and you guys know I go live every Monday and I go live every Wednesday. So I will be back live tonight, Wednesday, for Winning Wednesday at 9 p.m. Eastern time. And people were asking, what is it going to be? What is it going to be there for Winning Wednesday? I don't know yet. I don't know. But at the end of the day, it's all about helping you to pass your NCLEX exam. Now, I want to talk to you really quickly about those of you who have V2 and who've gotten into V2. Please, this is the study calendar. All right. Make sure that when you get V2, you print out this study calendar. This is step number 1. Everybody should have this study calendar who has V2, because the study calendar is going to tell you what you're watching every day. It'll also tell you when to study. Let me just grab it. It'll also tell you when to study your quick facts book. All right, because I want you guys to do the lectures first before you do quick facts. That is my goal. All right. So you should be able to go into V2 now, watch the lecture videos, create exams, all those things. All right. All right. So the study calendar, go in there and print that out. It's 20 study sessions. And this is also how you're able to finish V2 in 2 to 3 weeks. Okay. 2 to 3 weeks. Another thing I want to say is that we were supposed to stop the sale on Friday, but over 2,000 of you got into V2 during RNU, and on the final day, 500 of you got into V2. And so that created some cute computer glitches. And then also we updated the question bank. So a lot of you were not able to upgrade from your trial to the V2 final package for $89. So we are extending the $89 sale for the rest of July. Okay. So just as a appreciation for all of you guys giving us patience and things like that, we are extending the $89 sale for the rest of July. All right.
Show the challenge.
Oh, the challenge. Okay. And then also, we are also launching, to make you guys stay on track, we are also launching the 30-day challenge. Again, it's in the V2, right?
It's in the V2, but they can go to remarners.com/30 days.
Okay, to sign up for it. Can you put that in the, there you go. It's on the screen now. So we're launching the 30-day challenge again, just to help you guys stay on track. It is in the V2. I'm going to show you where it's at in the V2. Yeah, right. So we are, so the 30-day challenge here is in the V2 right here. Okay. So this is the mark on it. If you click on 30-day challenge, all right, it'll show all of the videos. And this is the first part of it, is the tutorial where you can, like how to start V2 and things like that. But the 30-day challenge is here for you to do every single day. All right. Of the study sessions. All right. So it's all there for you. If you want to sign up for the 30-day challenge, actually, that's even free. Even if you don't have V2 and you want to do the 30-day challenge, just go to remarnurse.com/30 days. And what will we send them? Will we send them the actual, we'll help you with the 30-day challenge. We'll get you to the free trial, and then you can get the video from there. Yeah. And so what you also get, if you sign up at remarnurse.com/30 days, are the daily emails to check in with you and things like that. So it's a really helpful sequence if you want to get in there. There's a 30-day challenge in the same like the V2. Yes, the 30-day challenge is the same as in the V2. So if you have V2 or if you have the trial account, you can see these videos. All right, you can see these videos. If you do the 30-day challenge, will it take time away from your V2? No, because the idea is, honestly, you're getting 3 months in the V2. So people are doing this program in 2 weeks. So when I say you're getting more than enough time, you're getting more than enough time. And the idea is, study calendar is here. After every study calendar session, you just watch the video that goes along with it. So for example, if you are on study session number 12, after that study session, you go to study session number 12. And the video, like you can see here, that video is 8 minutes long. So I don't think it's taking away time from your V2. 10 minutes, 8 minutes, 6 minutes, 8 minutes, 8 minutes. Like you guys know, I'm not there to waste up your time in V2. So an 8-minute video, we're going to just review the major points of the set of the study. And that's one of the reasons to help you move forward. All right. Yeah. So everybody that joins or everybody that has V2 is getting 92 days. So it will account for the time that V2 was down. Okay. Are they daily too? So it'll be a study session for every video, like Monday through Friday. Okay. Amazing. Okay, let me see. I test on August the 3rd. How should I proceed? Oh, you have plenty of time. If you don't test till August the 3rd, you have plenty of time to get into V2. And I don't know how you've been studying before, but if you feel like you want to just do content, you want to get that content, you can do it. All right. Because this will help you. I'm trying to show this comments. Everybody's comments were so good. Regina, I had a dream last night. Yesterday, I was so confused on which review program to use. I went to bed talking to God, asking him to give me a clue or a sign to help me make the right choice. I do that too all the time. And there it was. Your CD popped up in my dream. So now I'm going to be more committed and more dedicated to my V2. Thank you for everything. Thank you, Nicola. I see your name a couple times on the broadcast. It seems familiar to me. So, please just be dedicated and committed and let me know how else I can help you. I love that. Okay. I clicked on PN instead of RN when buying V2. How do you correct this for me? It's easy. Just email support@remarreview.com and our customer service team will just switch you out. They'll have to remove you because we can do that, right? Yeah, we'll just switch you out and put you in the different location. There's locations inside of V2, so you'll just be put into the RN location. But be very careful when you guys are checking because literally you see registered nurse or practical nurse several times when you're checking out V2. It will literally say RN or PN. So please, 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 please check that. I can't access the questions in the question bank. Can you show me how to do that? Yes. So let me just show her how to do the questions in the question bank. What score do you suggest for the CAT exam? It says I passed with 90 questions. Okay, so yeah, if you pass the CAT exam is not a score, like a percentage like we're used to in nursing school. It's a statistical probability. So if you pass the CAT exam, I'm sorry, I lost my train of thought, you're doing really well. Especially the lower number of questions that you pass the CAT exam in, the better that you're doing. Okay, let me go to the, okay, so your question bank is here. It says courses, and then the second one says question bank. So when you click on your question bank, this is where you're going to access your questions, okay? So I'm just gonna click on it, and your question bank is gonna come up. It will come up. It's taking a while, but it's going to come up. There we go. All right. So it's rendering 2,000 questions. That's how many questions are in your question bank. So you will see them all here. 2,000 questions. I've done about 300 on this account. I have 1,850 remaining. It's also going to tell you how many you got correct in a percentage, how many you got partially correct, and how many you got incorrect. All right. So we're adding questions to the question bank as we speak, but right now I'm really more focused on the computer adaptive exam because I have to, I want to make sure that those questions are statistically performing well, they're difficult levels, and I'm watching how you guys are doing in there. So that's how you get to the question bank. Okay. That made me feel so good. We didn't take my test. I used the program. Okay, cool. All right. And so here, when you do create a test, this is where you will actually generate your test. And so the first thing that you have to do is naming the test is mandatory, guys. So you have to name it. If you don't name the test, then it's not going to let you proceed. This is also where you take your computer adaptive test. So everybody in V2 gets 2 computer adaptive tests. You find your computer adaptive test in the question bank. All right. So here it is. Tutor test, computer adaptive test. Okay. Ola, I will, Mark, can you take down Ola's name so we can look at it? Okay. So Ola, we need your email. So if you message us your email right now, Mark can look at your account now because we want to make sure you get into what you're looking for. All right. So anyways, this is where you take your computer adaptive test. It'll tell you how many you have left. This account, I have 1 left here. I can do a tutor. I can do a test. So I'll just do this one right here is fine. And then this is the change that we made in the difficulty level on Friday, where before, remember, you could only do easy, moderate, or hard. Now you can do all levels at all the time. So that should be helpful for you guys. And then you can pick the subjects that you want. If you just want next gen, or if you whatever you want to do here, critical care, it'll show you how many questions. It's just like any, I guess, just like another, like, you know, customizing your experience. So let's just do this one and then scroll down. When it comes to the computer adaptive test, because some of you guys are saying, when should I take my computer adaptive test? Your computer adaptive test should be taken after you finish the study calendar. So essentially after your 20th study session. After your 20th study session. Yes, and say some of you guys already know it. After lesson number 20. Okay. So anyways, you just can do how many questions that you want to do on your computer not your computer adaptive test, your regular question bank test, and it will create the test for you and you'll be able to start. Okay. The computer adaptive test, let me just say this, don't start it until you are serious about being there for 5 hours, because it is a 5-hour exam and you cannot pause it. You cannot pause it. Is the computer adaptive one same questions as 2? No, there's enough questions in there. And there's enough questions in there that you should not be getting the same questions. Okay. Okay. So when you go into the question bank, you will have all different types of NCLEX questions in there. You will be able to have your case studies that are presented to you, closed drop down. You could read it. So it is a helpful tool. I know a lot of you guys love to do the questions first, but I always feel like you should start with the lectures. The lectures are going to be more helpful than the questions on an onset to me, because I feel like you can get questions anywhere, but the lecture content that I have is going to really help you see the big picture. All right. So this is my account in the question bank and I could just go through it. Okay. And you guys are not supposed to, I'm not, doing it in a way where you can see the questions or anything like that. I'm just showing you the functionality of the question bank. Okay. So highlighting questions, we have all of these types for you to do. And if you're using your study calendar, it will have you to do questions from the question bank, quick facts, or watching videos. Okay. All right. What's the difference between CAT mode and test mode? Very good. CAT mode is the exam that is going to simulate most of the NCLEX. So that will be an exam that will be timed. That will be an exam where you will only receive a pass or fail, and then it'll give you a printout. Where's my printout at? It's around here somewhere. It'll give you whether you passed or failed. And this is sorry, it's all messy now, but it'll give you this that you can print out, you can screenshot it. Maybe what I'll do is I'll give you a better picture of it. So that is what that is. It's a NCLEX simulation. That's a CAT exam. You cannot choose the subjects you get. You cannot choose the difficulty level during the CAT exam. The test or tutored mode, you're able to create that yourself. Okay, you're able to create that for yourself. So that is the difference between those two. I hope that helps. Okay, so that's the CAT exam. If you have any specific questions about your account, tracking for your books or anything like that, it's way better to just send an email to support@remarreview.com. Okay, because I can't look up your account information right now on live. All right, I want to be able to make sure that I'm able to service you guys the best. All right, one thing I wanted to show you, the question bank, so you guys know how to create an exam. I wanted to show you where you get your study calendar from, but I also wanted to show the CAT exam, because you won't be able to pause and restart the CAT exam. It's a 5-hour exam. So once you start it, you have to stick with it. The first time I did the CAT exam, it did take me 4 hours to do. The second time I did it in about 2 hours. Okay. What do I do first? The 30-day video or the V2? Remember, the first thing that you guys do is the study calendar. So I have you watching the videos first. That's the first thing you do. I'm going to show you in a second how to get to your study calendar. But I was talking about the computer adaptive exam. So what I want to show you is that V2 keeps a record of every test that you create. Every test that you create. So the CAT exam, you'll be able to see, okay, you took a CAT exam on June the 12th, and it is going to give you how you did. So you passed it in 90 items. That's amazing. The CAT exam is tough. Like Nurse Kim said, it is not an easy exam. So if you can pass it, then you're doing very well. Okay, you can pass it, you're doing very well. I want you to do this after your 20 study session, because if you don't, if you don't pass it, then you have another one to do and you can remediate yourself. Okay, does that make sense? Then you can remediate yourself. So that is how I want you to do the CAT exam. The first one after study session number 20, and then you can do another CAT exam about a week before your exam. Now, maybe you don't have time to do it. Maybe your exam is in 3 weeks and you're just getting V2 tonight. If you're just getting V2 tonight, then you need to focus on the lecture videos and quick facts. That's it. Okay. But if you do have the time, work in the question bank. The question bank helps you mostly with time management. The question bank is going to help you. So when you're reading those case studies, you're going to get a sense for, okay, it takes me 5 or 6 minutes to do a case study. That's important for you to know. The more you do, the less time it will take. Okay. I said do the first CAT exam after study session number 20. People are asking me, what study session number 20? Study session number 20 is a reference to my study calendar. Okay. My study calendar has 20 study sessions. So after the final study session, number 20, right here, after you get to study session number 20, then you can take your CAT exam. Okay. All right. So that's what I mean. Study session number 19, 18. And like some of them, I see you're not watching any videos. I'm trying to break it down for you as easy as possible. When you sit down with my program, I want you to know exactly what to do. Okay. Does the CAT exam shut off when I hit 85 questions or when I get the confidence interval? It won't shut off until you meet the confidence interval. It won't shut off until you meet the confidence interval. So you can go all the way up to the 145 questions. Let me show you how to get to your study calendar. Click out of here. If you go here on your left-hand panel, this is your file vault. It says file vault. You click on file vault, you'll have course resources or books and certificates. Okay, so you're going to go to course resources, and what's going to happen is it's going to pull up the course resources for that course. So for RN, this is where you find your study calendar, your workbook, any new resources that I put out, or anything about the quick facts book. Okay, these are files that you should be looking at, taking advantage of. All right, so if you go here, your very first one is the daily study calendar. Okay, the daily study calendar. So you can click on the daily study calendar and it's going to pull up that file for you. And the file is going to open up and you're just going to click on this blue arrow right here. And when you download it, it will open up as to this. Okay, and I'll just read you the top of it because this is how my program is structured. It says here, this study calendar is designed to make your life easier. Each week, do 5 study sessions. 1 study session each day is the best way to pace yourself. 1 study session a day also allows you time to process the information presented. You will need to print the workbook in order for this calendar to be most effective. Okay. Remember to keep your study sessions under 3 hours per day. Check off each task once it has been completed. If you follow the calendar, the course will be completed in 4 weeks. Okay, in 4 weeks. And so what that means is my intention is for you to just do 1 study session a day. That's it, just 1 a day. However, some of you guys don't follow that advice and you do 2 study sessions a day. It's possible for you to do 2 study sessions a day in my course. It's possible for you to do 3 study sessions a day. One of the reasons why it's possible is because the length of my material is realistic. So for example, this video is 16 minutes. This video is 15 minutes. This video is 12 minutes. All right. I don't have long 2-3 hour videos. The videos in my program, 18 minutes, 14 minutes, 10 minutes. And so you can get through my program really quickly. And I think that's one of the benefits of doing V2 is the lecture content is going to teach you in a way that you can study under 3 hours and give your brain a break. Plus, if you're following the study calendar, it gives you structure. So a lot of our problem is just the discipline of studying. We have it in nursing school, but once you graduate, you no longer have that structure where you have to be somewhere, you have to study. Most of you guys can prepare for NCLEX in about 3 weeks. Some of you will be 4 weeks. All right. So I just think that if you can get over the hurdle of finding a program that's structured for you and content that's digestible, you will do well. All right. You will do well. You can cancel your subscription by going to your account in your settings. Just go to my account. It's right here on this panel under settings. And then you can go to payment and billing. Okay, payment and billing. I don't want to open it up because it'll show, you guys know, it shows the account information. All right. So that's it. Everybody's working right now as quickly as possible. We had over 1,000 emails earlier today. It's a holiday weekend. We had to pull the team all in off of the holiday so that they can work to help answer all of your emails. All videos are locked. What do I do? So yes, when you get into the V2, you have to go in order. Like you have to go in order of the study calendar. This is not a program that you're able to just pick and choose what videos you want to watch. It's literally a training system. So you have to start at pregnancy. All right. So you have to start at pregnancy. Then you're going to do a clinical subject exam. If you have the study calendar, it's going to tell you. Then you have to go the newborn and normal high-risk newborn, infant heart defects. So you only go forward in V2. That's the direction that you go in. Okay. Professor Regina, I'm still in nursing school, almost through. How can Quick Facts help? Quick Facts is a reference book. So if you're in nursing school, you're able to look through this book for the topics that you're studying. Also, you have the pharmacology in the back. All right. And if you just have the Quick Facts books, Quick Facts has a calendar in it as well in the front of the book. The next gen version does. And so once you study a topic, you can check it to say that you've looked at it. But this will help. This will help you. Yes. If you don't pass the test, no, you can't proceed. If you don't pass, I have these tests here, and these are accountability tests. All right. These are accountability tests. So if you have not understood the information here and you can't pass this test, then you need to go back. You need to take the test again. And you can take the test multiple times. All right. You can take the test multiple times in order for you to pass it. But you have to get the minimum. And the minimum is not high. The minimum is like 60%. That's the goal. So if you can't get a 60% on the exam, then the content that I have after that exam, you're not ready for, because my program builds, the information builds on each other. All right. So that's why it's like that. But at 60%, you should be able to pass it. Okay. Send me an email. I would say definitely if you're in the trial version, you have to make sure you're in the paid version, because the books and study calendars and things like that are not in the trial version. Okay, how do I get Cat 1? Because Cat 2 is only showing. No, so what you're seeing is that you have 2 computer adaptive exams. I don't have a Cat 1 and a Cat 2. So the number behind the word Cat shows how many Cat exams you have. So you can go ahead, if you're ready, and take that first of your 2 Cat exams. Okay. But like somebody asked, can you pause it? You can't pause it, but you can walk away from it. Like the first time I took the Cat exam and it was 4 hours, I had to stop and take a lunch. So I just literally walked away from my computer screen, ate a salad, and came back. Okay. After study session 20, we're going to take the CAT exam. Right. Is it the time for us to study the question bank? The last CAT exam 1 or 2 weeks before the final exam? Yes. So because remember, if you're following the study calendar also has you in the question bank before you take your CAT exam. So by the time you take your CAT exam, you've already been in the question bank. So it's not something that you are waiting at the end to do. The calendar will incorporate the quick facts book and the question bank. Okay. But remember, the priority is always watching those videos. Scheduling my exam for July the 20th, and I'm so nervous. Don't be nervous. Don't be nervous. Be excited. Be courageous. Be courageous about it. Okay. It's something that you want to take. Your NCLEX is not something that you're fearful of, because it's an opportunity. And just like you said, you picked the date. Nobody picked the date for you. Nobody is surprising you with an anonymous test date. It's a date you picked. So you're looking forward to it. You're ready for it. Okay. Do we have to finish the whole bank before the exam? No. Mm-mm. If you want to get V2 tonight and you want to do the computer adaptive test tonight, you can do it. There's no barriers. Only barriers is in the lecture portion. You have to watch those lectures in order. But the question bank, you can do whatever. Okay? You can do whatever. You can go in there and you can just do questions. Bicey, it's not that I'm not responding to your question. I'm just not sure. So you can send me an email. I can send you the calendar. I can send you the study calendar. Okay. But it should be there. I mean, I'm looking at mine. It's there. Can I just watch the videos before following the calendar? You can. Absolutely. If you don't want to print out the workbook and you just want to watch the videos, you can. I think though your studying will be more impactful if you print out the workbook and actually write down the stuff that I'm saying. But you know how you study. Some of you guys are auditory learners, and so you learn that way, right? I'm definitely somebody that likes to have things explained to me. Mark will say all the time, "Can you come look at this photo? Can you come look at this?" And I'm like, "Just tell me what it is. Tell me what it is, because if I look at it, I won't understand it the same way as if I hear somebody explain it to me." Can you show how to test name in the question bank? Yeah, I can show you how to name a test in the question bank. I got your V2 package. How best do I make it work for me? I think just following study calendar. If you even do just one study session, you will be able to determine for yourself if this is going to work, like if this way that I tell you to do it is going to work for you. I can't really say what's going to work for you because I don't know you. I don't know how you like to study, but I do know that you have all the elements there to make it happen and to learn. So if you need to write something down, there is a workbook. If you need structure, there is a study calendar. If you just want to practice case studies, there is the question bank. Okay. How do we get tracking for the V2 quick facts? Just purchase V2 today. So you'll automatically get tracking for it. Remember, it is a holiday weekend, so people are not going to be shipping out anything until probably Wednesday or Thursday. All right. And so once your product is shipped, you will receive tracking by the email that you put in. Okay. I use V2 today. Love it. One study session down. Good. Where can I download the workbook? In the file vault. Let me go to it. File vault right here. Okay. So if you go to course resources, okay, course resources will pull up your course, and then you will get the student workbook right here. Okay. Student workbook is right here, and you will be able to download it by clicking on this thing. Okay. This is the same place that you find your study calendar. It's the exact same place that you find your study calendar and any new resources that I put in Any new resources that I put in will also be available. This is the downloadable workbook. Okay. And this is what you will print out at home, and you will be able to take notes and everything like that. Can you please do the calendar? Okay. That's it. That's how you get to the calendar. It's in your file vault here. Your file vault section has many goodies for you in there, so please take advantage of it. Let me see what else is in the file vault. Okay. New NCLEX resources. So you have Remar Nurse University workbook is in there. Practice maternity questions book. The ultimate NCLEX study guide. Do you guys have this? It's in the file vault. Let me see. The ultimate NCLEX study guide. Oh, maybe there it is. Okay. Block it. Let's block that. And I'm gonna pull it up for you. But it's a guide that I did that kind of explains next gen information. All right. So this is also in the file vault, and this is something that you can print out, and it will explain to you. All about why the NCLEX is changing. You can read about the model. Here, the new clinical judgment measurement model. All right. You can also think some questions for case studies if you want to break down case studies a little bit better. And these are all the things that I use as well. So practice exams. And again, this is in the file vault. This is definitely in the file vault. So make sure that you are actually using this resource and all the ways that I'm trying to give you guys the benefits of technology. All right. There's not another system like V2. Literally, it is coded specifically for a nursing student. All right. By a nurse for you guys. And you guys really helped me build it by saying you wanted this or you wanted that. Okay. Got a question from TikTok? Yep. What they say?
Based on the results from the CAT exam, how do you improve from there?
Yeah. So the CAT exam, the good thing about the CAT exam, and I'm going to show you how to name a test in a minute. Let me go to the CAT exam printout so you guys can see it. Because the good thing about the CAT exam is that the categories that you get are literally from the question bank. So you can go back into the question bank and just focus on those categories. So for example, let me show you the CAT exam printout. So the content areas. So even if you have passed overall, it will still say areas that you're below the passing standard on. All right. So these are areas that you can work on. So next gen case studies is telling you, go back and do some more next gen case studies, right? You have time to do that. Reduction of risk potential, your clinical judgment. Well, I was above a passing, but like we literally have a section called clinical judgment. So all of the categories, you're able to take this printout, and this is why this is the most important part of your CAT exam. For those of you who are like, I don't know, if you're using another resource that's doing CAT exams, at the end of it, you should have a direction on how to continue studying, because the CAT exam literally is supposed to be a way to guide you. All right. So go back into the question bank and focus on those subjects, because you can do that. How do I create a test? Okay. So let's go to the question bank and let's create a test, and let's name it at the same time. All right. So when I talk about naming a test, I'm talking about going into the question bank. And the very first thing that you do here is test name. Now, the test name can be anything that you want it to be. All right. It can be anything you want it to be. It can literally be July 3rd, July 3 test. It doesn't matter. You just have to name it. Okay. Here, computer adaptive test, regular test. This is how you get it. All right. If you want to get more CAT exams, you can get them here as well. Okay. CAT exam by itself, no part of V2 is sold separately. Okay. Yes, this is info on V2. No part of V2 is sold separately. So you can't just, you have to have an active subscription. You have to have an active membership to assess V2. So you can't just get the question bank by itself or the computer adaptive test. It's all like together. Okay. All right. And then, so that's what I want to say about that. You can't just purchase the computer adaptive tests or the videos, like they all come together. And then when you go through it, you get to just pick your test mode. Okay. You get to pick the question pool that you want. You also get to pick the difficulty level. You just click what difficulty level you want, and then you pick the subjects, and then the subjects will go into different lessons. Okay. So, and then you'll just put how many questions you want to do, and then whether you want it to be timed or untimed. Does that make sense? Okay. So that's how you create a test. It's pretty straightforward. And again, if you're following the daily study calendar, then you will get to the question bank. I think on study session number 10. Study session number 10. How long do we have access for the videos after these YouTube videos? Because I'm just starting nursing school. Okay. So with V2 right now, you are able to get 3 months access to the V2 platform. All right. 3 months access. And then after that, it renews for $50 every month after that. I'm telling you guys to take advantage of the sale price now, because for $89, you're getting 3 months access, which is amazing, because you're getting your content, your question bank, and computer adaptive exam for essentially $29 a month. That's it. So you're literally getting a $30 NCLEX review, like a month. That's it. Okay. Okay, so it is like you guys have to go to the website in order to get V2, or if you are in the trial version, you have to upgrade your account from inside of your trial account. All right, so if you go to the settings, you can do that. All right. All right, what else, guys? I got comments on Facebook, comments on YouTube. All right. So, okay. So yes, if you delayed your V2, you can start it. Like, so if you purchased your V2 and you delayed it, but you want it to actually start sooner, you're able to go into your V2 and do that. If you fail your first CAT exam, if you're taking the CAT exam and you fail your first CAT exam, I would say look at your content areas that you were below the passing standard on, go into the question bank and remediate. I would say give yourself a week to do that. Don't put your exam way off, okay? Because our CAT exam is challenging. So if you can get through it, I think you're in a good position. Can I delay my start date for the second time on V2? I think you can only delay your start date one time on V2. Okay. How can you renew the CAT? You would just buy more CAT exams if you need to. Okay. What about the renewal procedure? So Sarah, if you have your V2 and you purchase the V2 after the 3 months or whenever you start it, like literally you can delay your V2 into October now, because it's 90 days. So I think up until October the 3rd. But the renewal is automatic. If you cancel it, then you have to go back into your account and you have to reactivate your subscription. Let me know. Yes, the CAT exam is challenging. Yes, for sure. That's it. So the V2 will automatically renew itself after the 3 months have been completed. So whenever you start your 3 months, 90 days after that, V2 will automatically renew itself. You don't have to do anything. Okay. The CAT renewal, I don't think there's a CAT renewal. You can buy additional CAT exams, but I don't think there's a CAT renewal. if you renew your V2, okay, so let me say this. You need to use both of your V2s within 90 days because your V2s won't roll over. I'm sorry, your CATs won't roll over. Thank you. So within the first 3 months, if your V2 is active, plan to do both CATs before the subscription runs out. Okay, plan to do both CATs. All right, because if you renew, you're not going to get the 2 CATs from the initial. Does that make sense? Why the automatic renewal? Because it's a subscription model. That's how it is. It is a, what's the word I'm looking for? It's a subscription model. So it's just like Netflix or Hulu or something, anything like that. And we make it plain that you can cancel at any time. You can cancel at any time. So it's something you just take the initiative to do. For students outside of the US, is the V2 and QuickFacts NCLEX printable? So the V2 is printable. The QuickFacts is not printable. The QuickFacts is a physical book that we would send to you. Okay. It's up to you. I want to know, when can I get my order? I made a mistake when I made the order. Okay. So that's something, Monique, I'm going to have to be able to assist you personally with, because we would need to know the details. So the very best thing for you in order to send me all the information is, email support@remarreview.com. Okay. Can you make the payment for the extra CAT down to $20? Oh, I see. Okay. It's $29 right now. Maybe after the sale. I mean, right now my prices, my NCLEX review is literally $29 a month right now. And the costs that it costs for me to maintain the platform and pay the developers and customer service, like literally I'm trying to be a blessing right now. So I think my prices for what I give you guys, I think the value is there. I honestly do. And it's not considerate for me or my company or Team Remar to ask us to like lower prices and on top of everything that we do already. I just don't. I feel like sometimes as a minority or a woman, I'm always asked to lower my prices. Like that's one thing that people assume, but they just don't know like the very, very hard work it takes to be able to have this type of technology, how much it costs from a nursing perspective. You guys have no idea. You guys just have no idea. So I hope that everything that we do and all the time that we spend with you guys means something. And there's so many things that we do for free that we never asked you guys to pay for. So that's just what I want to say about that. I hope you guys can see the value in the products that we offer. CAT exam is for RN and PN. We actually have the CAT exam for the RN and the PN. I would say the RN is definitely the more challenging of the two, for sure. But the PNs definitely have their own CAT exam, and I think you guys should take it. I think you guys should be up for the challenge of taking it. Okay. What else? Thank you. Can I go through the process to get to the file vault? I just got into my V2. Sure, no problem. So the file vault is here. The file vault is here. It's the third icon on your I guess this is your directory of V2. So you have courses, question bank, and file vault. It should be there. Okay. The sale is going on all of July. It is going on all of July. So we want to make sure that you guys had an opportunity to update your accounts, get into your trial, also launching the 30-day challenge. So if you want to join the 30-day challenge, whether you're inside VT or not, you can sign up for it and you will get the emails for the study sessions. I do want to go live. I do want to go live a lot during this month as well. And I'm just trying to think of what else we could do. And somebody was like, we just need another workbook. It doesn't matter. So I'm kind of playing around in my mind how we can spend time together the month of July, but we do have the 30-day challenge that is launching. And so I want you guys to prioritize the 30-day challenge, please, because it's so helpful. It's so helpful. Yes. We put a lot of time into what we do for you guys here. Team Remar meets almost every single day. And we're working even during the holiday to make sure we get to all your emails. Support at remarreview.com if you want to send me an email like right now. Okay, so yes, you're getting the 30-day challenge emails. Perfect. So people say, do the games. Let's do games all the time. Okay, the games are expensive. I give $200 away to the top prize winners. I mean, I'm just saying, guys, we put so much into making sure that you guys feel loved and appreciated and rewarding you as much as possible. Oh my goodness. What do I do first, the V2 videos or the 30-day challenge? Good question. Because the 30-day challenge is based off of the V2 videos, do the V2 video. Okay. It's video than challenge. Yeah. We need more content like quizzes. Yes, the game. Okay. Thank you guys for answering each other's questions too, because I think Mark is just on questions right now and it's a lot. So there are topics in V2. You say, look it up. Do you mean additional study resource prepare or just, no, I just mean like, sometimes I just mean like Google, like just Google it. Like if I say a definition and you don't know what it is, just Google that definition just so you have a reference to it. I don't necessarily mean to send you on like a rabbit chase of the idea or whatever it is. Maybe if you give me an example, I could talk more about it. Should I do the subscription and the book? Mm-hmm. Yeah. So when you first sign up, the book is Quick Facts. I'm assuming that's what you mean. But when you get your study calendar in the file vault, it'll tell you what to watch, what to read, what to answer. Okay. Those are the three components: what to watch, what to read, and what to answer. I like that. Jenny says, do the games for free. We shouldn't have to be paid for helping with quizzes. They're helping. Yeah, I agree too. I thought about that too. Just free games. Okay, Loretta. She says, let me clarify. V2 50 per month and CAT renewal 29 per month. No. So V2 renewal is 50 per month. That includes a CAT exam. Additional CATs during your V2 is 29 per additional CAT. Okay. So that makes sense. So when you first sign up for V2, you get 2 CAT exams. If you want to take more than 2, you want to take your 2 and you want another one, that additional CAT exam is $29. Okay. When you renew V2, you automatically get a CAT exam included. So that's literally 50 minus 29. What is that? $21 for the renewal for the whole entire platform with the CAT exam. Yeah. The old physical workbook is the same as the downloaded one. Okay. The VT. Oh, so you're talking about the VT. Do I even have one? Essentially it is, but it is only thing differently. Like if you have the VT workbook from my old platform, this is for V2. This is for the old platform. So if you have this one, you can use it in V2. You just won't have the answers to your quizzes that are in here. So like your basic comfort exam, things like that in here, those are no longer in V2. So if you have the answers, already, then you can use this. Sure, you can use this. Okay. Fantasia says, can you explain the 30-day challenge? Because I thought the 30-day challenge was the 30-day calendar. Okay. That's good. So no, that's not the same. So the 30-day challenge is essentially study sessions. No, the 30-day challenge is me asking you questions about the V2 calendar study sessions. Okay. So that means that after you do a study session, the challenge is watch the video for that study session and see if you can answer the questions that I'm asking you. So on the study calendar, you're getting all of your content. You're watching videos. The 30-day challenge video is just me asking you questions. I'm not talking about any content at all. I'm literally just asking you, hey, what was important about what I said in that video, or answer this question. It's really good. It's really good. Can we get the calendar with the 30-day challenge? Oh, I would have to create it. It doesn't exist. It doesn't exist. So literally the idea is that after you watch your video for that day, that study session, you go and watch the 30-day challenge. But I guess I could create a new calendar. Study calendar is in the file vault. Okay. All right. I'm going to take like 4 more questions and I'm going to let you guys go because it's Monday night. This is my second study session of the day. I did one at 12 o'clock. If you didn't catch that, we went over acute renal failure. We did questions during that one. And now I'm back. Oh my goodness. My goodness. Yes, in the file vault. Why am I just seeing the download for the workbook? Make sure, are you in the trial version or are you in the full version? Because if you're in the trial version, then you will just see the, you're just going to see the workbook. Okay, so the $29 was just for the computer adaptive exam only. The computer adaptive exam only. Okay. All right, guys, when is the 30-day challenge starting? You can sign up for the 30-day challenge. Go to remarnurse.com/30 days. Yeah. So good question, Crystal. If you have finished your V2 workbook and you're just kind of hanging out in the question bank, you can do the 30-day challenge at any time. You can start, because what it'll do is it will ask you information about things that you have studied. And so you want to make sure that you're able to answer those questions in the 30-day challenge. Okay. 30-day challenge. You should see the, in the Shavania, all those elements should be there for you. If not, just send me an email. Okay. And I can log into your account. I can sometimes, I'll ask you guys for your name and your password. If it's me and I'm like on my phone or something, I want to see what you guys see. Okay. But send me an email, please. support@remarreview.com. It's not just for RN. We also have a PN version of this. All right. Let me show you guys really quickly how to order V2 and how to also delay your start date. So if you want to purchase it now, but you don't want to start right away, you need to do that in the beginning of the V2. So I want to show you how to do that. Okay. So if you go to remarnurse.com, just put it in your browser, go to remarnurse.com. What it's going to do is it's going to ask you, are you a registered nurse and a practical nurse? This is very important because some of you will be practical nurses and you will buy the registered nurse package. And there's no reason for that to really happen because right now it asks you the first time you will see it, are you a registered nurse or a practical nurse? So just slow down and make sure you pick whichever one you are. If you're a practical nurse, pick the practical nurse. Okay, so I'm just going to click on practical nurse. Understand LPN faster. Okay, go to get the course. And then it's going to tell you what you're getting. Okay, you're getting 3 months, content, lectures, all those things. The 30-day challenge is already in the V2. So you're going to go to buy now, and it'll tell you $50 renewal begins in 3 months, cancel anytime. So that's 3 months from when you activate it. So purchase, click on buy now. And then here, it's going to tell you what you get. All right. So you're going to get the course, the Practical Nurse course plus Quick Facts for $89. Now, if you already have this book, guess what? You can take it off. You can take it off. All right. Take it off. And the way you do that is just click that. All right. All right. $69. It goes down to $69. But if you don't have Quick Facts, you definitely need to add it because you should have Quick Facts. Also, if you want me to print out this book for you, this is where you add the printable workbook. If you don't want the printable workbook, that's fine. You can just get the this one that you print out yourself. That's already going to be in your file vault. So you can take it to a Staples or a FedEx Kinko's. But honestly, if you're printing it out yourself, it's probably going to cost you just the same as if I print it out for you. Because this book right here is $35. It's printed and it's binded for you. Okay. One of the other differences about this book is that it has the activity section in it. If you have the original VT workbook, you know the activity section, clinical judgment activities, but it's in here. Okay. So it's this book right here. But this is where you add it at. So you would add it here if you wanted the printed version of it. Okay, so that's a $35 charge. If you don't want that, just take it off. It's totally up to you. Also, this is where you can get First Shift. First Shift is my book on how to dominate your first 2 years in nursing. So it's like the survivor's guide for nurses. And people usually read this when they're trying to prepare for their first job. I give a lot of tips and tricks on how to do well in nursing in that book. I think this is 130 something pages, 131 pages for this book. This book right here is 122 pages here. Okay. All right. So let me show you though how to delay your start date. So to delay your start date, you need to go down here where it says click here to delay your start date. And so when you do that, it will open up a calendar and you can delay your start date all the way up to October the 3rd. Or if you want to study the end of September 29th, it doesn't matter. All right. And then, so that is when your V2 will start. Okay. And you can always change this date. You can make it earlier or you can make it later or, but you change it one time. Okay. And then you can move it up if you want to. Okay. All right. So that is it, guys. I wanted to jump on here. It was just supposed to be a game night, but I love doing questions and answers with you because I'm able to just address some very common things that you guys ask me all the time. And I think it's great because you want to know how to use V2. When you purchase V2, I want you to be able to get in, get started, and finish the lectures. Okay, finish the lectures. I do want to say happy 4th of July to everyone that's celebrating this weekend. Please, please be safe. Tomorrow, celebrating with your family. Keep those kiddos away from the open flames of the fireworks. Please make sure that you're safe. No ER visits, no ER visits tomorrow. You guys are the nurses, so you have to be the voice of reason, okay? All right, so thank you so much for attending the game night. I will be back on Wednesday at 9 p.m. The sale is extended the entire month of July. So we will just be implementing the 30-day challenge, helping you guys use the V2, feel comfortable, feel confident, get on track, okay? Get on track so that you can get in and get out. All right, guys, so have a good night. Happy 4th of July. Happy holidays, everybody. Remember, you can, you will, and you must pass NCLEX. That's it. That's it. Thank you, Nurse Kim, for coming on tonight with me. Your testimonial was amazing. With God is possible. Love that testimonial. Didn't you guys love that testimonial? That's it.